Educator wellness and wellbeing, the early years sector. Educator wellness and wellbeing within the early years sector is the topic examined in this presentation. What is the objective of this presentation? The objective of this presentation is to explore potential issues adversely affecting educator wellness and wellbeing, alongside discussing emerging implications if these potential issues remain unresolved. Furthermore, it will examine an implementable plan constructed to improve wellness and well-being amongst early childhood educators. Conclusively, the primary role leaders and advocates obtain in supporting wellness and well-being for educators for early childhood educators will be investigated. Issues potentially adversely affecting educators within my early learning centre. Through examining research involving early childhood educators and their relevant workplace well-being, conclusive evidence advises the potential adverse effects educators face resulting from extreme workplace environmental stresses, frequently attributed to the early childhood sector. Stress is a naturally occurring experience presented in everyday life, yet early childhood educators are experiencing excessive amounts of stress within the industry. This stress can be a result of workplace stresses, including navigating the demands and expectations of students, families, administrators, and society. Cesar and Buchanan, 2015. Alongside stress stemming from the low wages associated with the early childhood industry, Linen et al. 2017, a study conducted in Australia surveyed early childhood educators, in which 40% of educators reported actively experiencing psychological distress, Cumming 2016. In the absence of effective coping strategies, these high levels of stress can produce potentially negative outcomes, Cesar and Buchanan 2015. Another issue potentially adversely affecting educators and their wellness and well-being is the poor working conditions experienced within the workplace. These poor working conditions can result from the evidently low levels of social support provided within the sector, Core et al. 2015. These poor working conditions present a result of exceeding responsibilities placed on educators from the childcare management and providers. Educators are expected to complete paperwork, provide adequate supervision, create inviting learning programs, and complete a range of cleaning tasks. These tasks create unrealistic expectations for educators in early childhood centres, contributing to poor workplace environments. What are the potential implications to educators if these issues remain unresolved? The presence of poor workplace environments in early childhood learning centres can affect all stakeholders in the centre. This includes children, families, and educators. Educators facing a high level of stresses and operating in a poor workplace environment can experience emotional exhaustion and, as a consequence, job withdrawal and low productivity levels, Lovegren 2016. These unresolved issues can have potentially lifelong effects on educators when they remain unaddressed. Illnesses such as insulin resistance, hypertension, cardiovascular disease, and sleep apnea are among the consequences of these unrealistic expectations, Cumming 2016. These illnesses, although physical, can also have negative effects on educators' mental well-being. Having a sound mental health is essential in providing high-quality early education and care practice. Core et al. 2017. Lovegren 2016 research examines the low levels of social support educators receive within the workplace. The unsupportive environment has been attributed to a burnout, a syndrome caused by the experience of work stresses. Burnout consists of three primary dimensions: emotional exhaustion, depersonalization, and personal detachment. The complications consistent with these unresolved issues prove to affect educators' work lives alongside their personal life experiences. Actively working towards educator wellness and well-being in the early years sector. In order to improve educator wellness and well-being within the early childhood sector, an action plan must be implemented involving relevant strategies. Educators experiencing negative effects due to the high level of stresses faced in the workplace could benefit from access to meditation programs. Meditation can encourage wellness through the self-regulation practice. This practice can combat physical health-related issues alongside mitigating stress and improving mental clarity. Cesar and Buchanan, 2015. Management and providers play an important role in providing educators with support systems to facilitate the needs of staff members within the industry. Work climate and work-related well-being have a significant effect on educators' wellness and well-being. Educators would benefit from greater support systems allocated to staff members in the early childhood sector. Variables contributing to work-related well-being include good work climate, good pay, supportive colleagues, and role autonomy. Cumming et al. 2019, page 266. Therefore, educators being supported by management and childhood providers would have positive effects on well-being, alongside encouraging supportive colleague-work relationships. Core et al. 2017 examines the crucial role revising policy and procedure, including the National Quality Standard, would have on educators' current wellness and well-being. It would aim to address working conditions within the industry, which are essential for mental well-being and providing high-quality early childhood education and care. The implementation of these strategies and policy and procedure revisions could effectively improve wellness and well-being for all staff members within the sector. What role do leaders and advocates in the early childhood profession play in supporting educators' wellness and well-being? The role of leaders and advocates within the early childhood profession is crucial in supporting educators' holistic wellness and well-being. Organizations have a responsibility to provide educators with positive work environments that allow them to provide high-quality care for the children. Leaders can seek to address relevant policies involved with the educators' wellness and well-being and how a revision of these could drastically improve working conditions. In addition to a day-to-day manager, they frequently involve a committee or board, Cumming 2016. Ultimately, this can affect how money is allocated within the centre, which may not best serve educators and their needs to provide high-quality learning programs. Childcare is a largely female-dominated industry. Research within the US found women working in childcare were amongst the lowest income earners within the country. These low wages are consistent in many other countries across the world. Low income earners have the potential to face job insecurity and strain. Leaders and advocates within the early childhood profession improving educator wellness and well-being through their consideration and action against the low wages educators experience in the early childhood industry could see substantial improvements for well-being and job satisfaction. Linden 2017. Therefore, leaders and advocates could work collaboratively to improve working conditions and well-being across the industry. What did we discuss? In this presentation, we addressed the topic of wellness and well-being. It examined the potential issues that could affect educators' wellness and well-being within the early childhood profession, and the potential implications for staff if these issues remain unresolved. Alongside implementable strategies and experience to improve staff wellness and well-being in relation to the issues addressed. Finally, it explored the crucial roles leaders and advocates have in supporting educators' wellness and well-being in the early childhood profession.